Okay. So Russ, we're going to be, now I'm going to be demonstrating some of the special techniques that we use in the cardiovascular and peripheral vascular exam. And I'll be explaining a little bit more why we do each of the techniques. Okay. So the first special techniques have to do with the upper extremities or your arms. And I'm going to first, as I did before, I looked at the skin and the hair distribution and whatnot, but now I want to just feel with the backs of my hands the temperature on either side. It's easier to judge temperature using the backs of the hands rather than using the front of your hands. So you always want to do that. There's some other pulses that we sometimes check. One is the brachial pulse, and that's actually the same pulse that we use when we're testing blood pressure. That's where we put our stethoscope, but you can palpate that pulse. Again, for its amplitude, if it's regular, and its strength. If there is suspicion of or has been an infection somewhere in the forearm or hand, sometimes the nodes, the epitrochlear nodes in the upper arm get enlarged, and they're located right here, right above the elbow on the inside of the arm, and you can palpate for those. And most normal people without infection, you won't feel those nodes. That's where they're located. You can do the same thing on this arm. Okay. The other special technique we use is the Allen test. So Ross, this is a way of checking the patency or how open the ulnar and radial arteries are that go to your hand. So what I want you to do is to make a fist, and I'm going to occlude both of those arteries with my thumbs. And now have you open your hand, and I'll release the ulnar, and it should pink right up, which it does. Okay, let's have you make a fist again, and we'll this time really open, release the radial, and again it pinks right up. So you have good circulation with both the radial and the ulnar to the hand. We'll do the same thing on this hand. So make a fist. I'll occlude the vessels. Okay, open, release the ulnar, pinks right up, and again we'll do that. Open your hand, release the radial, and it pinks right up. So those are the special techniques we use with the upper extremities. Next, we're going to do a couple of techniques that we use with the listening to the heart sound. So I'm going to have you lower your gown again here. And if I had heard an abnormal murmur or abnormal heart sound, I might be able to accentuate it with this maneuver. So what I'm going to ask you to do is to lean forward while I listen. I'm going to have you take a breath in and exhale, and then hold your breath. Okay, so inhale and exhale, and hold your breath for a few seconds. Okay, and breathe. I'm going to listen with the diaphragm because this tends to be a higher pitched murmur, usually of aortic murmur, of stenosis, aortic stenosis, that will accentuate with that maneuver. Other maneuvers that you can have the patient do is stand up, squat, or do a Valsalva where they kind of bear down, and sometimes that can accentuate a murmur that you're hearing. You can also sometimes hear blood going through the kidneys, and if there's some turbulence, you'll hear a bruit or a murmur, and so we want to listen right over the kidneys on the back. And actually you'll want to use the bell. On either side. Okay, so remember the diaphragm is used for the higher pitched sounds. The bell is used for the lower pitched murmurs that you can hear. And make sure that you just apply it to the skin when you're listening with the bell very lightly. If you push, you'll actually turn the bell into a diaphragm just by the pressure stretching the skin. Okay, and same with the neck as we did before. Remember, Ross, we palpated your carotid arteries on either side. We can also take a listen to them with the bell on either side, again, to listen for any bruits or murmurs. And it's because you're breathing through your trachea and that sound becomes very loud when I'm listening, I'm going to ask you just to breathe in and hold your breath again for a few seconds. So, and hold, and breathe. And then we'll do the same thing on this side. And breathe. Okay, great. Okay. Now I'm going to have you lie back. I'm actually going to raise the head of the bed just a little bit. Okay, go ahead and lie back. And you can put your gown up partway. Keep you covered. We're going to be looking at your jugular venous pressure. So this, because it's really a pretty direct reflection of what's going on in the right atrium of the heart, and so that's why we like to look at the jugular on the right side of the neck. You turn your head to the left just a little bit. If you look tangentially, and sometimes it's helpful to actually shine a light tangentially to see the pulse, but I can see the top of the internal jugular here with the pulsation. So that is the mark that I'm going to be measuring. How do you tell a jugular venous pulse from a carotid? Usually you can't palpate the venous pulse, but you can see it. Whereas the carotid you can actually feel, but may not be able to see. He has a very pretty evident one right there. So how am I going to be measuring that angle? I'm going to be measuring it from the sternal angle. So you go down from the sternal notch to the sternal angle. And that's where my vertical line is going to be. Right there. Then I'm going to take my horizontal ruler. I'm going to go from the top of his pulsation, just about right there, trying to keep it horizontal to the floor. And I'm going to measure. And it's about 2 centimeters, which would be normal. 3 or 4 centimeters would be an elevated jugular venous pressure. Okay, you can relax. Oh, one other thing I meant to show you is that, go ahead and turn your head to the side again there. If you do see an elevated jugular venous pressure, if you add, or if you put some pressure on the mid-abdomen, you can watch that pulsation go up a little bit. And if it stays up, that is a positive abdomino-jugular reflex. Okay, so let's put your head back down again so that I can show some techniques for palpating the precordium of the chest. So we've already looked at the chest and previously for any pulsations or heaves or vibrations, and now I'm going to palpate. So I'm going to palpate in the same areas that I've listened, so in the aortic area, and I'm going to use my fingertips first. And then I'm going to palpate in the pulmonic area, down the left sternal border, over to the apex. Now, if I had heard a murmur on auscultation of the chest, then I might be able to feel the vibration if it's a significant enough murmur. I also want to feel for vibration with this part of my hand, the ball of my hand, in the same areas. So aortic, pulmonic, down the left sternal border, the apex, as well as the epigastric area for the right ventricle. The point of maximum impulse is going to be right at the apex of the heart, usually about the 5th intercostal space, mid-clavicular line. So I want to feel that with my fingers. And if I have difficulty feeling it, I can ask the patient to turn to your left. So Ross, could you turn just onto your left side? And that brings the heart forward and may enable you to feel that pulsation more. If you can, try to narrow it down to one finger so that you get the actual point of maximum impulse. You can feel yours there. Okay, go ahead and turn back. Then I want to auscultate the heart again in the supine position, and I'm going to do this time with the bell. So aortic. And I can also have you turn to the side again. Now, so listening in that apex area. Okay, and that brings again the heart forward and may help me to hear any abnormal sounds more easily. Okay. So lastly, I want to do some special techniques for the lower extremities. So I'm going to raise the drape up here a little bit. Up here. We did palpate for the femoral arteries, and I can also listen to that area for any bruits. So we're going to listen with the bell, feel for the pulse, and listen. That might be particularly important in an elderly person who may have poor circulation to their lower extremities. The other thing that I would like to do is check for any edema. There's several areas that we want to check on the lower extremities for edema, starting with the feet. So you can feel the fronts of the feet to see if there's any, just apply pressure with your thumb and then check to see if there's any pitting or any swelling. The backs behind the medial malleolus. And then the shins. And if you are discovering edema, you want to keep checking and see how high up it goes on the leg. Another test that we can do for arterial insufficiency or poor circulation to the feet is have you raise your legs in the air. So Ross, I'll help you hold your legs up in the air. And normally we would hold the legs up for about 60 seconds, and we're looking for the blood to sort of drain from the feet. And so we would hold them up until the feet look lighter or whiter in color. And then we're going to have you actually sit up. So, and then once, you just sit, yeah, just like that, and let your dangle on. Within about 10 to 15 seconds, the color should return to the feet in a normal fashion. If it's slow to return, then that would mean there would be some sort of insufficiency in the arterial system. The other thing that we can do is measure the ankle diameter. And the way we would do that would be to take a tape, pick the same spot of each ankle to measure. And so we get 24 centimeters, approximately the same spot on this ankle, 24 centimeters. So you would want to note if there was a significant difference between the two ankles. Okay, I think that concludes our special techniques for the cardiovascular and peripheral vascular exam.